It's 8:25. Let's head into the Zoom room now where Jenna Gaminde Blas from OCD. Sorry, it just always reminds me of. You guys got a joke about that over there, Jenna. The Office of
I hear it all the time.
Right, yeah. GHSOCD joins us this morning. Good morning, Jenna.
Good morning. Good morning, Chris and Bree. Great to see you guys.
Right, it is. Let's just get right into it then. So, what is the deal with the JIC and just the where we're at now? Because it kind of, out here we're really slouching towards normalcy, but I don't know what it's like in there in the bunker. So, what's like the status of you guys and the COVID response?
Bring up such a good point because while everyone is getting back to normal, we're still operating here 24/7 operations for our emergency operations center. We have been since the beginning of the response. It's really tiring for everyone that's on board, but we're just really appreciative for everyone that's working. The main things we're really quick to recognize, and rightfully so.
Oh, Jenna, hold on, because there's something. Sorry, there's something with your mic. It's like going in and out. Yeah.
Yes. What can I do?
It sounds like maybe it's up too high. She's in the bunker, right? Yeah.
It's like you're going high, you're going low, you're just
in and
going
out.
up and down. Yeah.
I need that IT service. Let me try calling in from my phone. Maybe that'll help.
Oh,
Can
yeah,
you hear me
dial
now?
it. Yeah, dial in. Yeah, using internet audio. That's always good.
Try this. You have a few
Okay.
minutes?
Yeah. Take your time. Hey, by the way, former Governor Carl Gutierrez is coming on, guys. He's entered the Zoom room. We're going to get to him after we talk with Jenna.
I just want to say, like when Dr. Hoa was on and his story, I hope everybody gets to watch that because it was a pretty amazing story. And, when you look at all that he's done through the pandemic and even before, because I first met Dr. Hoa. Okay. I think you're there. She's connected.
Okay, how about that?
Oh,
That's good.
Right on.
Much better.
Yeah.
So anyway, let's just start over. Like I was saying, out here we're really trying to get back to normal, but I don't know what's going on in there in the bunker. So what's the status of the response?
Okay, so as I was saying earlier, we're still operating 24/7 operations of our Emergency Operations Center. Our Joint Information Center is still operational Monday through Friday. We're still answering the phone lines for the community. You're seeing all the JIC releases still go out. So we've been operating since the beginning at this really high level. But you bring up a good point that the rest of the island, while they're returning to normalcy, we really appreciate all of those that are working behind the scenes here at the EOC. We're very quick to recognize all of the healthcare professionals, which is, rightfully so. The doctors, respiratory therapists, shout out to my mom, the nurses, all of those that are working really hard for this COVID response. And oftentimes we don't see the people that are working behind the scenes who have been since the beginning. So we appreciate you recognizing that, but we are still working 24/7 operations, people pulling shifts, being away from their families, all while doing their regular day-to-day jobs. So we're still here, part of the response.
Well, I just want to give a big hand to everyone who's behind the scenes. We see you. We see you, kings and queens.
I know you, Chris, Sabrina, and even Jason and other members of your team have actually been down here and seen it firsthand. So you can attest to the kind of work that goes on behind the scenes and how we operate down here. I know COVID's a lot different. We don't welcome a lot of new visitors or media down here anymore, but you've seen it firsthand. So we're still operating the exact same way.
I mean, I feel bad for you guys because the aircon in there is freaking crazy. It's like, dude, it's like 50 degrees in the civil defense. It is, right, sir? That's why you always, whenever we interview somebody in civil defense, you always see they have a jacket on their chair.
Mm-hmm.
Right.
Yeah. Not to make light of your, I know you guys are working hard. Jenna?
Thank you.
So what is the trigger for you guys to begin scaling back? Is it a change in the
are you talking about
for you guys being up 24 hours?
Yeah.
So of course we follow the guidance. We follow the guidance from our leadership, the administration, all the way down through our management. Our Civil Defense Acting Administrator, really calls the shot for our Emergency Operations Center. We do have an EOC director who also checks to see how the operations need to continue. But right now, there's been no change from 24/7 operations. A lot of it is due to the quarantine facility and the transportation that's needed at night. So there's a lot of activity happening at night and still transporting, even COVID positive patients. A lot of things that are happening beyond the normal 8 to 5 hours.
Mm-hmm. Yeah, and I know I came in at night when I returned from my trip, and you guys were up and running, and it was a really smooth operation. And I thank you.
Right, I did see your coverage on it, so that was great.
Mm-hmm.
Well, while we're on the subject of quarantine, everyone's talking about now that we're allowing fully vaccinated people to skip out on the quarantine. We're wondering about the status of the quarantine hotels and when we're going to see a scaling back or maybe a reassessment of what we need
Or the
versus
consolidation.
Right. Yeah. So I guess that's our next question: is where are we at on that?
Sure. So the assessment portion has been completed. Our office, in coordination with Department of Public Health, along with the National Guard, has reviewed the incoming passenger census. We continue to do this on a daily basis, and the room utilization in the government of Guam's QFAC. And based on the number of people in the facilities, it was determined that there will be a consolidation. I know that this has been highly talked about, not only from our office, but this will go through a formal solicitation process. A lot of people have asked, how will this be procured? We're currently going through the procurement process, so a bid will be sent out shortly. We're working to move forward with the consolidation of the 2 facilities into one. And this is based on the quarantine guidance from CDC, our public health officials from Department of Public Health. And this is also based on what the executive office decided for our territory. So we are working towards that consolidation.
Jenna, I remember early on in the maybe not even early on, maybe like midpoint of the pandemic, I can't remember who it was, but someone had come on, it was one of the doctors, and brought up the issue of having quarantine and isolation in the same facility, in terms of you have isolation where it's like known positive COVID cases, and you have quarantine, which is putting people in for observation. So are we going to be able to have both those systems running under one roof without risking either population?
Yeah, that's a great point. I know early on, there's a lot of different data that was going out. And again, with this novel coronavirus, this is all new to a lot of people. But fortunately, we've gotten a lot of great new additional guidance from CDC, where we are actually able to have a quarantine and isolation facility in one facility. There will be, of course, separate rooms. There will be separations between the two. There's a lot of different guidance that's gone into the different, to the scope of work from Department of Public Health. So we've received a lot of information and what is exactly required in order to put into these bid specs. So it's very specific based off of CDC guidance. But now there's new information where we are able to hold both quarantine and isolation facility in one facility.
Mm-hmm. Do you have an estimate on how much we have paid out so far and how much is still owed for the QFACs? And then we can go into the ISOFACs.
Yeah, sure. So the latest we received from our finance was, as of yesterday, for the quarantine facility, which is JUCIT, the paid invoice was $26,994,590. We have an unpaid balance right now of $11,092,547. And Bree, I'll just shoot you this as a text offline. That way you can have the exact number.
Okay. And that's for both QFACs, right?
That's for the quarantine facility. If we're looking at just the isolation facility alone, we have a paid invoice of about, $7,184,205, an unpaid balance of $150,000.
And just curious, is that are we using federal funds for this, or we pay local funds and then we get reimbursed?
So this is funded by the CARES Act. It has been since the beginning of GHSOCD's procurement.
So now
CARES Act.
Go ahead.
Sorry, I don't want to speak for our federal counterparts, but CARES Act is one of the only. Well, it's the only federally funded exception where we're able to get public assistance, reimbursement from this. So it's able to be reimbursed federally, which is really interesting because the federal programs are not typically like that.
Right.
Mm-hmm. Have we been? And this is federal reimbursement through FEMA.
That's correct.
And we've been fully reimbursed for, I guess, the $26 million that we paid out to date?
No, but we are collecting all of these documentations that are needed to submit the request for reimbursement. So, we continue to gather all of this information in order to submit our request.
Do you know offhand, or do you know how much we've been reimbursed for so far?
Let me double check. Let me see if I have that data. I don't. Last I heard it was up to about 4 million. But as soon as I get that data, I can shoot that to both of you offline.
Okay. And the 4 million we did receive in the FEMA reimbursement, was it for the DUCIT or was it for when we were having people at
Packstar
and the other
Days In?
Yeah.
This is specifically for the ones that are procured through GHSOCD. So that was through the quarantine facility at DUCIT.
Okay, so
as you may recall, Bree, there was some issues with the quarantine at the Packstar.
Right, and that was not procured through GHS and OCD. Correct, Jenna? Correct, Jenna?
That's correct.
Okay.
That's correct.
Okay.
That's correct, Your Honor.
So how soon are you guys looking to do the consolidated QFAC and ISOFAC?
We hope to move really quickly. We have the documentation ready. We hope to get, I don't want to give out a certain date,
Okay.
but the bid process will start shortly. We're just reminding all of our partners, just be prepared. It will be sent out shortly. I just don't have an exact date.
Is it going to be through emergency procurement or regular?
No, this will go through the standard process. I'm glad that you asked that, because although we're in a public health emergency, GHSOCD, our finance admin, has continued to submit to GSA the required 3 quotes for every requisition. There's no sole source procurement for QFAC and ISOFAC. That's processed through GHSOCD. So this bid will go out as the standard procurement process.
Mm-hmm. And when the new procurement for the consolidated QFAC, ISOFAC, is that going to be based on the rooms that are actually used, or are we also going to pay for the rooms that are not being used? Because currently we pay for rooms that we use and rooms that we're not using, but the rooms that we're not using, it's at a lower rate, right?
Right. We do plan for unoccupied rooms as part of the bid process. We want to be prepared for any type of surge. We talk about downsizing. We've already made some moves. For instance, with our isolation facility, through GSA, our office has reduced the number of rooms in the ISOFAC from 270 down to 150. That was on March 31st. And then we did another reduction from 150 down to 50 with the ability to surge as needed. So we're always looking at ways that we can have the ability to surge.
Okay.
It's also going to be dependent on the negotiation. It's not just the bid that we put out. It's also going to depend on the negotiation process behind that.
You mentioned that it's a very specific bid. I mean, do you have any of the specifics that you're able to share in terms of, so we're looking at a joint facility, like offhand, do you know how many rooms total we would maybe need?
I won't be able to put that data out yet, but I just want to let you know that, this is in coordination with Department of Public Health. We got all of the different information that they require to operate a very good streamlined QFAC and ISOFAC, information from our partners with CDC. So, I won't be able to put out information specific to the bid, but,
Right.
As soon as it does go out, we'll be sure to let our partners know, let the media know. That way there's an opportunity for everyone to see it.
Is it going to still be run by the National Guard?
That's under discussion right now. That's under discussion.
Wow, let's not bring the cabinet back in now.
No, but I mean, if
quarantine.
it's not the National Guard, is it going to be?
Wait, hold on. I'm sorry, Jenna, just disregard. What was it again? Quarantine Angels or something?
Who?
What they were called before?
Quarantine Angels or I
I
forget
don't-
what. Yeah. Anyway,
Remember when the directors were running the?
we're just
the
making it
quarantine
awkward
Yes,
for
yes,
her.
I do remember.
Yeah, sorry.
I do remember. But I will say, we're super thankful to the National Guard for
Amen.
everything that they're doing and how they're operating there. It's been really smooth. We're really grateful that they're there. And if there's an opportunity to still have them there, that would be ideal.
Yeah, they did. They were awesome. I mean, I must have called down there like
You
a
went
couple
through
of
it firsthand.
yeah.
Yeah.
I called down there a couple of times for sometimes just because I wanted somebody to talk
Yeah,
to.
she was thinking it was the crisis hotline, like stalking the guard down there.
And you know
I
who knew
watched
there's
your
like a limit? No,
coverage.
you can't have more than a 6-pack of beer. Like, what?
Jenna, are you guys involved with any other procurements? I mean, I'm sure you are, but like some of the main ones.
Those honestly, QFAC and ISOFAC are the main ones.
Okay.
We're obviously still operating with procurement behind the scenes with different types of supplies or what's needed for the different agencies, but those would be the major one: QFAC and ISOFAC.
Okay.
Okay.
That's it. Is there anything juicy you want to share with us that we forgot to ask about or maybe didn't know to
I
ask?
do. I just have the juiciest information I'm about to partake on everyone here.
Okay.
You know, I did cover thanking our Emergency Operations Center, and I appreciate you guys noticing that as well. But I do want to mention that we have Typhoon Preparedness Month coming up in June. We're going to have a proclamation signing on June 1st. It'll be virtual. But, you know, we're going through this pandemic now, but we want to remind the community that, you know, we can still experience natural disasters. So we're going to take the whole month of June, a lot of things virtually, a lot of information on our social media. So follow us on GHS Facebook and Instagram. Visit us on our website, ghs.guam.gov, and see how you can participate in Typhoon Preparedness Month. More information
You
to
never
come.
let us down, Jenna.
Yep.
Never. Just a way to end with the real juice there.
Thanks, Jenna.
Are you
Good
excited?
to see you.
Okay, thank you
I
all
mean,
so much.
Are you excited for next month? Because, I mean, you guys have been like in COVID mode, and now you finally get to do something that's not COVID. You must be so happy.
I am. You know, with my job, public information officer, and a lot of our program managers here, we look forward to that type of outreach
Yeah.
and engaging with the community. So, you know, instead of being here in the bunker and being able to talk to other people about things that, you know, we care about, we're passionate about, and that's preparedness. So we look forward to it. And so we encourage everyone to participate with us.
Thank you, Jenna.
Thanks, Jenna. I know you've been there
Thank
a long
you.
time
Thank
up
you,
there,
everyone.
so we
Yeah.
will feel safe that you're there. So thank you.
Thank you so much. Take
All
care,
right.
everyone.
All
Take care.
right. There you go, Jenna. Gaminde, Blas, 841. Quick break, and we're coming back with Uncle Carl next right here on the link. Good morning.